Now we'll perform the Weber's test, that tuning fork. So since I don't have any tuning fork, so I assume that it is my tuning fork. I activate it by tapping the fork gently against the back of the hand and near the knuckles, or by stroking the fork between the thumb and index finger. We would place the base of the vibrating fork on the top of the patient's head. So we're gonna stroking the fork between the thumb. We're gonna tapping the fork gently against the back of the hand. Then, vibrating fork on the top of the patient's head. And we would ask the patient if the patient is able to hear the noise. We would not proceed in performing the range test so as the client to block hearing in one ear intermittently by moving a fingertips in and out of the ear canal. As you can see, I am still performing the Weber's test, and I'm going to activate now the tuning fork to perform the range test. So after activating your tuning fork, place it on the mastering process in one ear until the client states that the vibration can no longer be heard. And we would also place the vibrating fork in front of the client's ear, so remove any any accessories that hinders in the ears of the client. Now let's proceed in assessing the nose and sinuses. For assessing the nose and sinuses, we're going to use our speculum and our pen light. First is we're going to be conducting the health history. This includes allergies, difficulty of breathing, infection to the nose and face, any nosebleed, any medication taken, and we will position our patient comfortably. In assessing for the nose, inspect the external nose for any deviation, nasal flaring, its size, the color, and any presence of discharge. And I'm going to be using also the pen light for determining the discharges. Lightly palpate the external for any masses or displacement of bone and cartilage. So I'm going to palpate the nose, the external, then now we're going to be assessing the patency by asking the client to close the mouth and exert pressure to the nose trail and repeat the process on the same nose trail. So asking the patient to close the mouth, and exert pressure to the nose trail. Now we're done. Now let's proceed in assessing the nasal cavity. We're going to be using my pen light, and we would inspect for the nasal septum. Then, saan mali? Ay, mali ako. Uy. Now we're going to be assessing the patency by asking the client to close the mouth and exert pressure to the nose trail and repeat the process on the same nose trail. Then now, let's proceed in assessing the nasal cavity. We're going to be using my pen light rather, and we will inspect for the nasal septum. Any deviation, any presence of discharge, redness and swelling. Then we will position the head lightly tilted and determine for any presence of obstruction. back. Now, we're going to be placing now our nasal speculum gently. So, the nasal should be placed gently to prevent any pressure in the nasal. So, nasal. Ano ba, placing na our nasal speculum? I-search the nasal speculum.
Murag kuan.
I-click.
Okay. Namin. Tindog sa amin, tindog. Ambang sa katulong.
Tutok mo.
Wala mo katulong. Ano?
Tutok.
Now we're going to placing now our nasal speculum gently, but since I don't have nasal speculum, so I will assume that this pen again is my nasal speculum. So the nasal should be placed gently to prevent any pressure in the nasal speculum, and we will hold the hand position, then hold the light accordingly for the guidance and for determining any pressure that obstruction. You would also inspect the integrity and position of the nasal speculum on each of the nostril. So can you we would allow the patient to take a quick rest after the process. Then the avoiding of the pressure of the nostril will be prevented. Take note that the nasal speculum should be about 1 centimeter up to the point to the which the blade widen, and we will also determining for any redness, swelling, and abnormalities in appearance of the nostril. Now we're going to be assessing the facial sciences. You can use your index finger inculcating the maxillary and frontal for any tenderness. So now we're done. Let us proceed on assessing the mouth and oropharynx of the patient. So you should prepare the materials, which is the tongue blade. So since I don't have a tongue blade, I will use this as my alternative. Then gauze and pen light for visualization. Assess the history of the patient, the last visited to the dentist, length and time of ulcer or lesion if there are any dentures, medication received. Then we're going to position the patient in a seated position. So, first, we should assess first the lips and buccal mucosa. We're going to inspect the outer lip symmetry, contour color, and texture. We can use the pen light and ask the client to purse the lips as if the client is going to listen. Then we would inspect and palpate the inner lip and buccal mucosa for the color and moisture. Then, let's inspect also the teeth and gums. While examining the inner lip and buccal mucosa, you will ask the client to remove denture if there is. Then note the condition of that denture. So, let's proceed to tongue and floor mouth. Inspect the tongue for the color and ask the client to protrude the tongue and move it from the side to side. Can you open your mouth, sir? And you will move your tongue side to side. Then we're going to inspect the movement by letting the client to roll the tongue upward and move it from side to side. Again, upward. Open your mouth, sir. And move your tongue upward. Upward, downward, and left, side to side. Then inspecting the base of the tongue, we are going to inspect for the mouth floor and the frenulum. Then palpate the floor of the tongue using the piece of gauze and palpate for any noodles and lumps if there are any. There are any. Can you open your mouth, sir? Now the salivary glands. To inspect the salivary glands, let the client open his mouth and inspect if there are redness and swelling. Can you open your mouth, sir, and use your pen light in order to see clearly the inside of the mouth. Can you up? Then now let's proceed on assessing the palates and uvula of the client. Inspect for any color, shape, texture, and presence of any bony prominence. Then ask the client to open wide the mouth. Then tilt the head backward. Then use the tongue depressor here with my gauze. Then use the pen light for visualization. Then now let's put this inside the mouth and use the pen light for visualization of the what is the inside of the mouth. We will inspect the position of the uvula, the mobility while examining the palates, and observe the uvula by letting the client say so that the soft palate will rise. So we're done now. Let's proceed to assessing the oropharynx and tonsils of the client. Take note for the color and texture again. And we will also inspect one side at a time and to expose one side of the oropharynx by pressing a tongue blade and use the pen light for lighting. So, I will press the tongue with the blade and use the pen light for lighting. Then inspect also for the color and size of the tonsil. Then we would elicit gag reflex by pressing the posterior aspect of the tongue. So now we're done of pressing the posterior aspect of the tongue. Let's proceed on assessing the neck of the client. In assessing the neck, we should inquire if the client has any history of the following. It should be any problems with neck lumps, neck pain or stiffness, and when and how any lumps occurred, any diagnosis of thyroid problems, and lastly, any treatments such as surgery or radiation. And now we're going to inspect the neck muscles. So if able, ask the client to hold the head erectly and observe of the head movement. So this is the clear view of observing the head movement. By asking the client to move the chin chest, chin to tip, chin chest. Then move the head back so that the chin is pointed downward and upward. Then upward. Then move the head so that the ears is moved toward shoulder each side and turn the head to the right and turn to the head to the left. So let's move your ear right side. Then to ear to the shoulders. Other side. Then ask the client also for the muscle strength by turning the head from one side to another side with resistance of the hand and repeat to the other side. So, look for the other side and the other side also. Then shrug the shoulders against with your resistance of your hand. Shrug. Then place hand to shoulders and allow the client to shrug shoulders against resistance. Shrug. Next. Proceed. So now let's proceed on assessing the lymph nodes. Now we're going to palpate in the entire neck for enlargement of lymph nodes. Can you... Then the trachea also, we're going to palpate in the trachea for the lateral elevation using our thumb. So place your fingertip or thumb on the trachea in the suprasternal notch. Then move your finger literally to the left and the right in spaces, bordered by the clavicle, the anterior aspect of the sternocleidomastoid muscle, and the trachea. So now we're done assessing the neck of the client. So now let's proceed to the thyroid gland. In inspecting the thyroid gland, we would stand in front of the client and observe the lower half of the neck overlying the thyroid gland for symmetry and visible masses. And ask the client to hyperextended head and swallow. It necessarily offer a glass of water to make it easier for the client to swallow. Can you open your mouth? Assuming that I have a glass, it has water. Swallow. Palpate the thyroid gland to smoothness. Note any areas of enlargement, masses, or nodules. If enlargement of the gland is suspected, auscultate over the thyroid area for a good sound and use the ball shape of the stethoscope. And last, document findings in the client record if you're done to assess the thyroid gland of the client. So now we're done on assessing the skull and face, eye structures and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, and neck. So that would be all. Thank you.